Hey dear soul, today I'd like to talk about chronic pain. Chronic pain is one of the most common and complex conditions affecting veterans. It often begins with physical injury, but over time it becomes more than tissue damage. For many, pain is intensified by stress, trauma, sleep disruption, and hypervigilance. The nervous system stays on high alert, and when that happens, pain signals get amplified. This is not a weakness. This is neurobiology. Understanding the pain amplification. Chronic pain involves a process called central sensitization. The brain and the spinal cord become more reactive. Veterans with combat exposure or PTSD may already have a sensitized stress response system. When trauma and pain overlap, the body remains in fight or flight mode. Pain signals intensify. Muscles tighten. Sleep decreases. Stress hormones stay elevated. The result? Pain feels louder, sharper, and more constant, even if the original injury has healed. Opioid dependence risk. Opioids can reduce acute pain in the short term, but with chronic pain, long-term use carries significant risk, tolerance needing higher doses, physical dependence, increased sensitivity to pain over time, opioid-induced hyperalgesia, overdose risk. Veterans are at higher risk due to co-occurring PTSD, depression, sleep disturbances, and prior exposure to injury. Healing chronic pain requires expanding beyond medication. The goal is not just reducing pain, but retraining the nervous system. CBT for chronic pain. Cognitive behavior therapy for chronic pain is one of the most evidence-based approaches used when the VA system. CBT for pain works by targeting pain catastrophizing. Thoughts like, this will never get better. I can't function like this. These thoughts increase stress hormones and muscle tension, which increases pain. CBT teaches veterans to identify automatic pain-related thoughts, evaluate their accuracy, replace them with realistic, stabilizing alternatives. Example, shift. I'm in pain right now. This flare-up will pass. I have tools to manage it. Behavioral activation. Pain often leads to avoidance. Avoiding movement, avoiding social connection, avoiding activity. Avoidance deconditions muscles and reinforces fear of pain. Cognitive behavior therapy introduces graded exposure and pacing. Small, structured increases in activity. Planned rest, not reactive rest. Rebuilding confidence in movement. The nervous system learns movement is not danger. ACT, acceptance and commitment therapy. Where CBT works on changing thoughts, ACT changes the relationship to pain. Chronic pain may not fully disappear. ACT teaches pain is a sensation. Suffering increases when we fight what we cannot control. Values still matter even when pain is present. Core ACT skills, acceptance, allowing discomfort without escalating resistance. Cognitive diffusion, seeing thoughts as mental events, not commands. I can't handle this becomes I'm noticing the thought that I can't handle this. Values-based action. Even with pain, veterans can still live aligned with service, family, integrity, and growth. Pain may be present, but no longer dictates identity. Biofeedback. Biofeedback uses sensors to measure muscle tension, heart rate variability, skin temperature, breathing rate. Veterans learn how stress changes physiology in real time. Then they learn how to reverse it. Through controlled breathing and muscle relaxation, they can lower heart rate, reduce muscle guarding, decrease sympathetic nervous system activation. This retrains the nervous system to shift from fight or flight into parasympathetic recovery mode. Pain intensity often decreases when physiological arousal decreases. Mindfulness for the pain. Mindfulness is not ignoring pain. It is observing pain without laying fear and resistance on top. Practice example. Focus attention on breathing. Notice the sensation. Describe it neutrally. Tight, warm, pulsing. Return to the breathe. Over time, this reduces pain catastrophizing and emotional reactivity. Brain imaging studies show mindfulness changes activity in pain processing regions of the brain. The pain may still exist, but suffering decreases. Integration. A nervous system approach. For veterans, chronic pain is rarely just physical. It is neurological, psychological, behavioral, often trauma-informed. Effective healing combines CBT for chronic pain, restructuring thought patterns and activity cycles, ACT living by values despite discomfort, biofeedback regulating physiological arousal, mindfulness reducing suffering and amplification. Medication may still play a role, but it's no longer the only tool. Chronic pain does not mean broken. It means your nervous system has been under prolonged stress. Healing is not about eliminating every sensation. It is about regaining control, flexibility, and purpose. Your pain is real. Your resilience is real, and your nervous system can learn safety again.